Hi, my name is Andrea Anderson. I'm taking a class at Northwest Technical College here in Bemidji, Minnesota, Introduction to Public Speaking. I am doing a persuasive speech, and this is my audience. This is my mother-in-law, Patricia. This is my husband, Casey. My speech today is about abortion and abortion rights. There's been a lot of controversy today, this day and age, with abortion, so we want to kind of go over those things and talk about them today. Um, Pro-choice is not pro-abortion. I can't see myself.
I
um,
can see you up there if that helps.
oh, thanks. Pro-choice is not pro-abortion. I imagine myself in a congressional room, arguing with Republican men and women on a podium in a heated debate, proudly practicing my rights as well as fighting for my should-be basic rights as a human being. Abortion is often needed for life-saving medical procedures. There are differences between states, so be sure to research which laws you live in. Um, Pulmonary hypertension is a very necessary reason for abortion. Women diagnosed with this disease have about a 50% chance of dying. Hypertension is when the pressure of the blood vessels connecting to the heart and lungs is too high, which puts huge strain on the heart, sends us into heart failure, and can be fatal. Considered to be very serious. Um, Ancestral is a serious condition and birth defect in which a baby is born without parts of the brain. It is a type of neural tube defect. It's called an NTD. Um, as a neural tube forms and closes, it helps form the baby's brain and skull. The upper part of the neural tube, spinal cord, and backbones. The lower part of the neural tube. It happens when the upper part of the neural tube does not close all the way and is often results in the baby being born without the front part of the brain, the forebrain, and is thinking and coordinating portions of brain, the cerebrum, are incomplete. The remaining parts of the brain are often not covered by bone or skin, and the Centers of Disease Control and Prevention in 2022 say so, and they corroborate that. Why is just restricting abortion not work? What are the consequences for women and in the United States, and what laws does it affect? Um, who are the laws made by, controlled by medical conditions? Women's rights, according to the World Health Organization, 23,000 women um, die from unsafe abortions each year, and tens of thousands more experience significant health complications globally. A recent study established that banning abortions in the United States would lead to a 21% increase of number of pregnancy-related deaths, overall 33% increase among Black women, simply because staying pregnant is more dangerous than having an abortion. Increased deaths due to unsafe abortions or attempted abortions will be the last resource for women who have no access to safe and legal procedures. And the horrific consequences of such abortions will become a major cause of death and severe health complications for some of the most vulnerable people in the country. Women should have the right to privacy. Abortion is a very intensive and intrusive procedure to begin with. Anytime anything is something is physically put inside of your body, it leaves you vulnerable. You must lay on your back with your legs open for them to see. Procedures like abortion are mortifying, causing the patient a lot of anguish. Having politicians tell doctors how to treat patients is unethical, in my opinion. Putting political objectives into hospital settings is dangerous, and it's a recipe for disaster. Politicians should become licensed medical professionals if they want to be giving women important and serious medical advice. When a woman finds out that her fetus is stillborn and is 25 weeks pregnant, she will have the right to get in
Easy.
a DNC. Otherwise, the only alternative method is a natural birth. So they would have to carry that baby to term potentially, and they would, you know, have a lot of stress. Uh, Roe versus Wade, the Supreme Court justices on Friday, June 24th, 2022, the United States Supreme Court overturned Roe versus Wade, the landmark piece of legislation that made us accessible to abortion as a federal right in the United States. The decision dismantled 50 years of legal protection and paved the way for individual states to curtail or outright ban abortion rights. Already because of trigger laws in place before the ruling, abortions are now legal and outlawed in many states, automatically or through state action following the decision. In addition, Justice Clarence Thomas wrote certain other landmark rulings should be reconsidered, including establishing rights to birth control, same-sex marriage, and relationships. That would be from Hausman 2022. Donald Trump elected 3 court justices in 4 years. There's 9 court justices. 6 of them are now Republican and 3 are Democratic, even though they don't really have a standpoint on their politics, so to say. The conclusion is who do abortion rights restrict and affect? Women, above all, abortion is a healthcare option most often needed by people affected by the social inequalities of poverty, racism, and xenophobia. Almost 75% of U.S. abortion patients live in at or below the 250% poverty federal poverty level. More than 50% of abortion patients are women of color. 60% of all patients already have children. The only alternative to abortion is childbirth, which is 14 times higher risk of death than abortion. With all what I just said, I would like to end it on that note. Abortion should never be taken lightly. Being put into a position where you have to pick yourself or your baby is traumatizing and overwhelming event. Nothing anyone wants, nothing to be desired. I would like to think that most people would do what's best for themselves and the fetus and would help with the help of medical and surgical services. I don't think most men have a great emotional intelligence or understanding of what some of the things women have to go through, abortion being one of them. So thank you for listening, and that's the end of this.
Where we could argue.